Today is Thursday, March 26, and unfortunately, the number of COVID-19 cases in our state has been increasing. As of yesterday afternoon, the Illinois Department of Public Health reported 1,865 cases, and here in Will County, 50 cases were reported. At Silver Cross, we have had 11 inpatients, test positive for COVID-19. Fortunately, we are following all infection control guidelines to make sure that all of you are safe. And I have to point out that our team in materials management is doing an outstanding job securing supplies. They really are your partners for safety. Today with me is Dr. Silvio Morales, who is the chief of the medical staff at Silver Cross, and Dr. Chris Udovich, who is our chief medical officer. Dr. Morales, let me start with you. What's your message to the medical staff and the hospital staff at this time?
Well, really, my first and foremost message is a message of gratitude and thank you. The way that the Silver Cross community has come together, whether it be the medical staff, hospital clinical staff, hospital support staff, the executive team, has really made me proud to be a member of the Silver Cross family. The outpouring has been outstanding, from physicians on staff volunteering to screen patients in the emergency department to the leadership that the executive team has shown in the daily command center meetings. Really, it's reassuring to me as the chief of staff and as a practicing physician in a high-risk area. The leadership, the decision-making, the nimbleness, the responsiveness to the needs of the hospital has been very reassuring. Some individuals that need to be thanked in particular, and I apologize for leaving anyone out, it's not to minimize their contribution, but Dr. Gupta has been outstanding. Yeah. His leadership, his knowledge base, his calm, reassuring manner in meetings has really helped keep us focused and keep us focused. Midwest Respiratory can't say enough about how they have responded to what we've asked them to do, and I know that likely, and they know that in the coming weeks we're going to be asking them to do it even more. Yeah. And their work has been just inspiring. And then of course the staff on units like 6-3 and 6-4, the newly converted unit on 1-6, and the staff I work with every day in the emergency department. The work that they have done is beyond, and all I can say is thank you from the entire Silver Cross community and our community that we serve.
Yeah, thank you. I'm sure they appreciate hearing those words. Dr. Udovich, I know you've had to make some rapid and difficult decisions that affect members of the medical staff. Do you want to give us an overview of what's been going on?
Sure. First, I want to express my appreciation for Dr. Morales and the whole medical executive committee. We've really depended on you, and you've done a great job in terms of being responsive to the needs of the physicians and the community and our patients. So some of the real difficult decisions that we've had to make and policies to implement is one, mandatory consults. So we've mandated that a Midwest pulmonary physician is consulted on all suspected COVID patients or positive patients. We've done this for a couple of reasons. One, we wanted to make sure that we had a consistent policy on physicians seeing these patients and conserve our equipment. So when these patients, only the Midwest respiratory physician is going in and doing the actual physical exam. The other physicians are still communicating with the patient and families if they're requested, but they're doing through the phone. So they're still coordinating, they're still involved in the care, but it has been at a distance so we conserve and minimize exposure. Secondly, we've deferred elective procedures. So working with the chairs of surgery, endoscopy, cardiology, interventional radiology, we've defined what is really an emergent procedure. We've defined what is an urgent and what is truly elective, so that we can defer those procedures that can safely be put off for 8 weeks or so. But those that need to be done in an urgent time frame, next 2 to 3 weeks, they are getting done. And those that are done emergently can get done as well. Likewise, we've done the same thing for radiology procedures or radiology testing. So we've worked with the radiologists to make sure that things that can be put off can, but if they are not able to be put off, they are being completed. We've talked to the staff and the physicians. If a patient needs to be admitted, they are truly being admitted. Some people will be going home if we're still investigating whether they have COVID or they are positive for COVID. That is okay. We want our patients to be home in the most appropriate setting. The last thing we've really done is refined our algorithm and how we are treating and testing these patients. What does it take to understand what they have? What do they truly need to get done so we can conserve our resources and get them back to the most appropriate level of care?
You mentioned that we've postponed elective surgeries, but we are doing emergency surgeries. Can you say a little bit about what if a COVID-19 patient has to come to surgery?
Sure. So many thanks to Dr. Verghese, Dr. Sin, and the whole anesthesia department and staff. They've been a great job in really preparing ourselves for people who need surgeries or procedures. We've been able to turn 2 ORs into negative pressure rooms so that we can handle these patients safely in there.
Well, I must say that we are really blessed to have such a wonderful medical staff here at Silver Cross. Dr. Morales, let me turn to you. What's going on in the emergency department?
Well, certainly everything's changed in the emergency department, just like everywhere else in life. We do have, starting from the front door, we have a screening process where we have hospital staff outside the emergency department doors, screening patients who may be at risk, masking them right away, trying to isolate patients as soon as possible for an infection control standpoint to protect staff and other patients in the department. We have seen a little bit of an uptick in our number of PUIs a day. We haven't seen the surge yet that the experts are telling us is coming, but we have seen a bit of an uptick, and that really impacts our workflow in the emergency department from physician or mid-level provider workflow to nursing, phlebotomy. Anybody who interacts with the patient, their workflow is completely changed. Anyone who interacts with the patient. Certainly things like diagnostic imaging get affected. We do have 8 extra negative pressure rooms in the emergency department that should come online later this afternoon. That'll give us a total of 10 rooms, which really is outstanding for a community hospital emergency department to have the capability for 10 negative pressure rooms. Many may have noticed we also have a tent that's been erected outside the emergency department. IEMA set up that tent for us. At this point, we are not using the tent, and we hope to not have to use the tent. But we are working on a contingency plan for how we would treat patients and which patients we would see in the tent should the volumes and patient need mandate that.
Wow. I can't thank you enough for all the work. You, the other emergency room physicians, all of the staff in the emergency room who's on the front line every day, you've really prepared us, and so thank you. Appreciate it. You know, Dr. Udovich, I was thinking and wanted to ask you about our primary care physicians, especially our hospitalists, board call physicians, other primary care physicians that round. How are they doing?
Well, they're doing well, things considered. They are working extremely hard. So remember, not only do they have the COVID epidemic that we're dealing with, but they have to deal with all the other patients with all the other medical conditions. So sometimes it's really a challenge to discern what is causing some underlying symptoms, and a lot of times they might be overlapping. So they are working very hard, but they feel supported. I think they have the equipment they need. They're taking care of the patients and also really coordinating with the family, because remember, they are the ones that have to communicate all this to the family and try to make sense of this when things are changing every 12 hours, it seems here.
Yeah. Well, many thanks to all of them as well. And I think all of us have to be empathetic and support them emotionally however we can. Speaking of test results, Chris, and looking to see what is it an underlying condition or is it COVID? How quickly are we getting test results these days?
So with the COVID testing from LabCorp and the Illinois Department of Public Health, we're getting them somewhere in the neighborhood of 5 to 7 days. The ones from the Public Health Department have been turning around a little bit more quickly recently. But Dr. Dole and his laboratory staff have been really working hard on this, and we think we've secured some new laboratory testing and new companies that will get us test results back within 24 hours. And we're hoping to implement that today.
That is really good news.
That would be a
many
game
thanks
changer.
to the lab staff and Dr. Dole and his team for that. So Dr. Morales, you started out saying your first message was one of thankfulness and appreciation, but I think you also have a second message. Do you want to share that?
I do. I think it's so important that in this time where our individual energies are taxed, our resources are strained, that we remember to take care of ourselves and each other as well as the patients. We all know that physician burnout is a significant and growing issue across the country. We do have a robust physician wellness program here at Silver Cross. But I want to remind all caregivers, providers, anyone who's at the bedside, anyone who's stressed by this, to remember to take care of yourself. Take time to rest, to eat, to decompress. Don't turn the news on at night.
Yeah.
If you have a way to exercise, do that. If people who nurture you, find ways to communicate with them, even if you can't be in person with them, but reach out to them. And if you find yourself feeling like you may have an issue, or a colleague who may have an issue, please don't hesitate to reach out either to the medical staff office at 815-300-7097, or at any time to Chris, Fred Alexander, who chairs the Wellness Committee, or myself. We will do everything we can to support you.
Yeah, that's a really important message. And the same is true for everyone who works here at the hospital. We have an employee assistance program. We have an employee assistance fund. We'll put more information about that in our message today. But thank you both so much for leading the charge here and keeping everybody safe and healthy. And please take care of yourselves as well. Thank you.
Thank you.
Thank you.